Earlier this month, we brought you a special report on ME. It's also known as chronic fatigue syndrome. We were contacted by sufferers asking us to help them highlight the condition. Such was the response. We're following up that story. Tonight, we speak to two women battling every day to manage ME. We'll also be hearing from a doctor in America who believes Northern Ireland lags way behind when it comes to providing the necessary services for patients. Niall Donnelly has been investigating, and you can give us your views on our Facebook page or by using our Twitter hashtag UTVL2N.
I've been really affected by ME from I was 14 till I was about 19.
I woke up one day and my head was so sore I could hardly open my eyes. My legs wouldn't move to take me out of bed.
There is clear evidence that the immune system in these patients is dysfunctional.
I couldn't basically move. I was laying just in the one spot. 23 hours was due to sleep, and the other hour of the day was to try and get food into me, or to give me a quick wash, or to have a bit of socialisation with my mum or with my brother, with my grandparents, you know, whoever was in the house at that time.
21-year-old Holly Maxwell-Norrie describing just how ill she was after being diagnosed with ME at the age of 14. Now 21, Holly freely admits that without her own determination and the help of her family, including Grandma Burrell, she would not have made the progress she has. Holly has completed a HND, is retaking her A-levels and is hoping to go to university. Holly says ME often left her feeling down and depressed, but now she thinks she is controlling it rather than it controlling her. Holly believes the health service needs to do more for people who have the condition.
There's nothing available, in my opinion, for people in Northern Ireland. My pen pal comes from England and she was telling me there's very little over there, but they have clinics, ME clinics, for sufferers to go down to and to get help, whereas over here you're just basically, right, you've got ME, away you go, and you're just left to deal with it by yourself.
It's estimated there are more than 7,000 people in Northern Ireland with ME. Most of them are treated by their GP. There is no specialist unit within the NHS here to deal with the illness. However, here at Belfast City Hospital, there is a weekly clinic that sufferers can access. But to avail of that service, patients need to be fit to travel and have to be referred by their doctor. Hazel Bland from Saintfield attended the City Hospital clinic. She has battled ME for 20 years. Hazel found the service very useful, particularly the help given by an occupational therapist. But she insists more needs to be done.
What we could do with primarily is someone like a registered nurse who knows the ins and outs, that can go and actually speak to the people that are bedridden, housebound, the people that can't get out anywhere, especially in the 11 months that I suffered. People don't want to come and see you because they don't know how exactly you're going to be. But somebody to come and speak to you, just to reassure you even.
ME forced Hazel to give up her job, but when she was working, she paid for the services of an alternative therapist.
She actually gave me some medicine that actually came from America. It's not available in this country, it came from America. But she treated an awful lot of patients with ME. Now, in saying that, I wish I could still afford to go to her.
Dr William Weir is the medical advisor to the ME Association in Northern Ireland. He believes government needs to spend more money on providing better services for people with the condition and on educating some GPs as to how to make a proper ME diagnosis. But Dr Weir says it's also very important that the exact cause of this illness is found.
There was a very prevalent school of thought that this condition was due to psychological disorder. And there are still many in the medical establishment who think it's just that. But the evidence, I think, nowadays is irrefutable in favour of immunological dysfunction. Many patients I see tell me that they feel they've got the flu all the time, and it's a very different condition from depressive illness, which is sometimes the label which is applied to people with this problem.
UTV invited the Health Minister, Edwin Poots, to answer questions about the lack of resources for ME sufferers, but we were told he was not available. Niall Donnelly, UTV Live Tonight, Belfast.
Well, the Health Minister may not be available, but Dr Dr Enlander is. Originally from Belfast, Dr Enlander has been researching ME in the United States for many years, and he's opened a clinic in New York. Regarding this divided opinion on ME, there are many who believe it is a psychological condition. What is your view on that?
This is not a psychiatric or psychological disease, that this is a physical disease, possibly actually related to an immune system dysfunction.
What treatment is there for
Patients actually have difficulty in having the condition diagnosed because there is no specific test for this disease. So that means that doctors actually have a difficulty in understanding this disease and even diagnosing it. So if you have difficulty in diagnosing it, you're going to have difficulty in treating it. But it is treatable with immune system adjuvants. In fact, actually, there's several studies underway in New York using Ampligen and GCMAF, which is a Belgian substance.
You'll be aware of the money pressures that there are within the National Health Service here. So what's the very least that patients should have here?
I believe actually that we should have a multidisciplinary approach to this disease. Physicians as well as psychiatrists looking at this disease. The psychiatric ailment in this disease is secondary to the primary physical disease. This is a physical disease.
How much of a difference would an introduction of services here make for patients and for their quality of life?
I think immense change, because patients actually can actually have their schooling interrupted. Patients who are at university have to actually give up their education. Patients who are in professions and careers have to give up their work, have to give up their profession. The impact on the gross national product is immense. I don't think the government has even actually acknowledged that.
So would you say that these patients are being failed by the system?
I believe they're not being well served. And I believe actually that we're going to have a meeting in the Lansdowne Hotel. Patients are going to actually see actually what can be done, and I will actually be giving a lecture at the Lansdowne Hotel on March the 1st.
Dr Enlander in New York, thank you. Well, if you'd like to watch any of tonight's programme again, or if you want help or advice on this subject, visit our website, that's u.tv, and follow the links to the story. Now, still to come on the programme, Andrew